In recent years, the total number of medical school applications and the average number of applications per student have risen dramatically. This sharp growth has increased workloads and emotional and financial burdens for applicants. I'm Stephen Morrissey, managing editor of the New England Journal of Medicine, and I'm talking with Rochelle Walensky, the Iyer Fellow in Health and Biotech at the American Academy in Berlin, a senior fellow at the Harvard Kennedy School, and an executive fellow at Harvard Business School. Dr. Walensky has co-authored a perspective article about the burden of applying to medical school. Dr. Walensky, what's known about the cost and the time involved in applying to medical school in the United States?
First, I want to just acknowledge that the co-author of this piece was my husband, Lauren, and this was really motivated by us watching the process over years and then us seeing it more personally. What we know now is that the medical school applications have gone up dramatically, as you noted, and that over the last decade, they've actually gone up on average 40%. And this surge is actually more striking for MD PhDs even than MDs. Median spending in 2019 was about $1,200. And in 2023, just 4 years later, it was about $1,500. So this is a 25% increase. We also know, according to student applicant surveys done by the AAMC, that in 2019, about 23% of applicants reported that they were applying to more than 25 medical schools. And that increased by 50% just 4 years later in 2023. So an extraordinary amount of time and an extraordinary amount of money is now being devoted to medical school applications.
So what's behind this escalation in the number of applications per student? What accounts for that trend?
Well, we do know based on what the students are saying and what is coming up in social media, actually, is that they are getting advice for more gap years and more schools. And it's not entirely clear that more gap years and more schools is serving them well. So when we look at the AAMC data from 2013 to 2023, over the last 10 years, we know that applicants have only gone up by 10%, that matriculants to medical school have gone up by about 15%, but total applications have increased by 40%. And applications per applicant have increased from about 14.4 to 18.4. When we look at these data and we see is that leading to any more success, it in fact hasn't. The success rate, as measured by matriculants over applicants, was indeed flat over this time. So we believe they're getting advice and they're seeing what is happening to the cohorts of students who are applying in the years prior to them, that if they take more gap years or apply to more schools, that will somehow lead to more success. And in fact, the data are demonstrating otherwise.
And then beyond that lack of success, what are the effects of this increased application burden on the applicants?
So if you look at what's happening with secondary applications, we can see that many secondary applications require somewhere between 6 to 8 secondary essays. And this is leading to a huge amount of burden and time as students apply to medical school. We report in our perspective one anecdote that we have been given permission to share, but this I think is really indicative of what is happening with students. This was an Ivy League student who had a grade point average of 3.85, a 96th percentile on her MCAT, and she took a gap year. She applied to 33 medical schools at a cost of $4,900. And for those 33 medical schools, and this very accomplished woman, she got invited for 2 interviews. She was rejected by all of her safety schools under the premise that she would likely never go there. And in this application cycle, she was waitlisted at one of the schools she interviewed and she never got in. So here we have somebody who is extraordinarily accomplished and has an incredible profile. And yet, despite applying to 33 medical schools with a huge amount of work in those secondary essays, she was not invited to a medical school class. Now, she was persistent, fortunately, and applied the next year, took a second gap year, applied to 49 schools at a cost of $6,400, and ultimately was given a full scholarship at a top 5 school that denied her an interview the year before. So these are the anecdotes that Lauren and I were hearing about and what motivated us to start sharing some of these stories and look at the primary data.
What reforms could help ease that burden, the burden of applying to medical school?
In the piece, and I want to acknowledge that the views expressed in this piece are those of Lauren and mine, not those of the school institutions in which we are affiliated. But we propose several solutions which we think might very well be helpful. First, I think we need a robust and standardized pre-health advising program. Students are getting different advice from their different universities and colleges, and the advice of more gap years and more applications. Interestingly enough, if you take more gap years, the person who is giving you this advice is more and more disconnected from you because you haven't been in that institution for a while. So we propose actually a centralized advising platform, which might be staffed by really committed mentors. So this advice can be standardized and perhaps dissuade some scattershot applications or people applying to many, many different schools. After that standardized pre-health advising program, we actually suggest that there should be a limit on the number of schools that students are permitted to apply for. If this limit is applied across the board to all students and all schools, then this will actually start allowing opportunities, maybe say 10 to 12 applications, where you're applying strategically and purposefully to a mix of safety schools and to reach schools, which signal your real intent and genuine interest in attending those schools, rather than 50 schools where you say, I don't know what my chances are of getting into any of them, so I'm going to apply to as many as possible. This would allow, again, strategic and purposeful applications, but it also will save quite a bit of money for those who can't afford to apply to the many, many schools that many people are applying to right now. The third suggestion that we put forward is to standardize the secondary essays. As I mentioned, now some schools have up to 6 to 8 secondary essays. You can imagine how this balloons if you're starting to apply to 25, 30, 35 schools. And our students are actually spending their full summers in the application process at an opportunity cost of many other clinical, laboratory, humanitarian experiences they might have. If there were consistent prompts for every school, let's say 2 to 4 questions or say 500 words each that were standardized, then students could actually be really intentional about what they put in their primary essay and really thoughtful about what they are able to put in each of these secondary essays. And then it would also allow each of the schools a singular essay to say, why are you interested in us? And that means that students would have to do some research on those schools to recognize, articulate their specific interests in those schools, and really have a more strategic match at the schools that they are potentially interested in. And then our final recommendation was to consider ranked list admissions. This is obviously what is done during residency match, and it may pose some challenges in allotting things like financial aid. Those would need to be addressed. But it would give students greater agency, and it would align the students and the schools' preferences and intent to come. So we actually think all of these recommendations would lead to a more streamlined approach, would lead to less ballooning of all of these applications, and would lead to a much better match of students' intent to go to a school and schools' intent to have them come.
Getting back to the burden for a moment, in another recent Perspective article, Holt and Elster write that nearly all medical school applicants now spend some time shadowing a physician. And of course, that also has financial implications. How do you think schools should promote professional identity formation and engagement among applicants? Is there a role for extensive shadowing?
This was a really interesting piece by Holt. And one of the things I think that really stood out was shadowing clearly led to more higher rates of admission. If you could document more shadowing, that led to higher rates of admission. But it was also interesting that shadowing was correlated with family income. And so while I think it's important to understand through some of these shadowing experiences whether you really do want to be a physician and whether this profession is correct for you, I very much agree with the authors who sort of comment that the level of engagement is not clear. What are the objectives of these shadowing? What are the assessments? What are the strains on the clinical environment? And how can we sort of take these and leverage these experiences without actually simply documenting hours? Can we look at experiences in a hospice or a paramedic or some other way to sort of demonstrate that you're interested in this profession and yet not have it be so quantified by the hours, but really have it be a more meaningful engagement?
And I want to ask you too about a third perspective article, this one by Iyer and colleagues, which talks about the trend toward pass-fail grading in medical school. And they express concern about its potential effects. How do you think schools could promote well-being and intrinsic motivation while also emphasizing clinical excellence?
Yeah, this was also an interesting piece, and I have seen this debate go back and forth. I think there's been real concern. Certainly, there's more volume of material to learn in medical school today than there was 30 years ago when I was in medical school. But I do really agree with what Iyer is saying in terms of both improving the students' short term well being, but really understanding that it does have implications for intrinsic motivation. And I think that the biggest call in this piece that I think was really important was to understand what are the correlates of what are our learning objectives when our students are in medical school, and how does that link to how these students care for patients over time? And are there ways that we can benchmark and understand data, potentially even through clinical trials of our students, where they would be meaningfully engaged and they would recognize that they are participating, to really understand what are the ways that we teach, the ways that we engage that both promote student well-being, promote intrinsic motivation, and ultimately lead to the goal that we are looking for, which is to have really exceptional physicians at the end.
And then finally, again, getting back to the burdens, what steps can medical schools take to ensure that qualified applicants and talented students aren't held back by these high costs and the other undue burdens?
I really do think that it will be hard for any single medical school to do this in a vacuum because so many students are feeling the burden now that they need to apply to many, many schools to have a shot at getting in any. My anecdotal experience in talking to students who have applied is you have to apply to many, many because you never know where you get in. And in fact, the comment is you never ask somebody where they want to go to medical school because they go to medical school wherever it is they're lucky enough to get in. I think if there were across the board changes where medical schools would agree, or the AAMC would agree, that there is a maximum number of applications that can be submitted by any given student, students have to be strategic in that, say, let's say, dozen of some safety schools, some reach schools, and some that they sort of feel like they have a good solid shot at. Then when you only have 12 to apply to, really, as you're applying, it very much sends the intent that if I get into this medical school, I will come. And I think that that is critically important message to send to our students, especially our exceptional students who are falling through the cracks. Maybe one final comment to say, we can't afford right now to have anybody fall through the cracks. We have 25% of Americans living in health professional shortage areas for primary care, and an estimate of in the next 10 years that we will be 140,000 physicians in deficit. So as we're seeing those numbers of the real demand for workforce, our job in the medical field is to encourage these young students and say, wow, we need you more than ever. And wow, we are really inviting you to be part of our medical school. And we really want to do everything we can to foster that feeling along.
Thank you, Dr. Walensky.